everybody. Thank you very much for attending our presentation today. Just to start off with some introductions, my name is Marie. I'm one of the CBT therapists and Deputy Clinical Lead for Westminster Talking Therapies. Paige, do you want to introduce yourself?
Right, and my name is Pei-Yun Lu, CBT therapist. Nice to see you here. Can we see them?
I don't think we can see everybody, but that's okay, not to worry. Magdalene, do you want to introduce yourself?
Yes, so hi everyone as well. My name is Magdalene and I am a Psychological Wellbeing Practitioner.
And hi everyone, I'm Melissa and I also have the same role as Magdalene, so Psychological Wellbeing Practitioner.
Great. So today we shouldn't be taking too much of your time. We're just here to kind of discuss psychology career pathways and also talk about the project that we would like to offer you all. So we're going to be just quickly discussing understanding mental health services in the NHS. We're also going to be talking about our roots and how we got into our current roles, the programme as we mentioned, and there should be some time at the end to answer any questions that you may have. So we've put here that our aim for today is to give you an idea of essentially different, oh dear, my thing just keeps moving on its own. There we go, sorry. Different mental career pathways with the goal to encourage diversity in the field of psychology. So one of the reasons we started this program is because we're very aware that the field of psychology typically doesn't have much diversity. It's often a lot of different backgrounds don't tend to come into the psychology field. So we want to kind of, like we said here, encourage you to get involved in the field. You're already studying psychology, so that already is a great first step, but also to let you know about the different roles available, and hopefully this presentation will give you a better idea of that. Okay, so just to begin with kind of talking about NHS psychology services. So we describe them as primary, secondary and tertiary care services. So all us four work in what we call primary care. So this is usually the first presentation, typically talking therapies, and it might be the first stage once you've discussed a referral with your GP. So this is what we would call kind of the lowest level or entry point for psychological work. Secondary care is working with clients with a more complex and long-term condition. So these might be clients seen in the community, inpatient places, but also crisis. And finally, tertiary care is highly specialized areas like forensic, neurology, or any kind of specific presentations like eating disorders or something like a complexity that's been there for quite a long time, but more difficult to treat within secondary care services. I don't want to kind of give you too much around this because actually what we specialize in is primary care, and it's again at most times is the entry point of psychological careers as well. So hopefully this will give you a good idea around that. We also wanted to kind of just let you know around how NHS services pay, because that's obviously a really important factor that people do want to consider when getting into the NHS. So we've put here that all NHS services follow an agenda for change banding system. With the level that I work on, that might be banded around a level 7 or 8. Other therapists might be banded around 4 or 5 depending on their experience. So if you are interested around the roles within an NHS service, you can just kind of Google this for yourself, Agenda for Change. It's very readily available. It's not kind of hidden information. So again, it will give you a bit of a perspective around what psychological careers you can go into and what kind of the pay banding is like for those as well. Okay, I'm going to pass on to Melissa and Magdalene, who will now kind of talk a little bit around what it's like for them being a psychological wellbeing practitioner.
Yep, so I'll kind of start us off then. So as I said, kind of a psychological wellbeing practitioner is kind of part of step 2 in our model. So what we do is kind of low intensity cognitive behavioral therapy interventions. So in terms of what this looks like is we assess common mental health problems, generally anxiety, low mood, panic, as well as any sort of phobias. And we have about kind of 7 assessments across the week. And then the other side of that is also the treatments. So again, for these common mental health difficulties, and it's usually about 28 treatments in the week. That's in Westminster, but it does vary across the services, the amount of what we call clinical contacts that you have with patients. But as well, there's other kind of roles, there's other, I guess, responsibilities as well around that. We do, check in around people on waiting lists, depending on the treatments that they're waiting for. We, of course, also have additional roles, which I think we'll get into a bit later on, as Magdalena and I both have different roles in the service. But just to explain a little bit around, I guess, what the treatments can look like, what we do is quite a practical therapy. So in our sessions, treatment's about half an hour, and we really look at kind of people's thoughts, people's behaviours, and see how that may be contributing towards the difficulties that they're kind of presenting with. And what we try to do is get that shared understanding and then provide them with practical tools and strategies that they can kind of practice outside of sessions, and hopefully build into a sort of a toolkit for them to kind of become their own therapist to manage things in future. But that's a kind of brief overview of what we do. Yeah.
Perfect. Thank you very much, Felisa. So as Melissa said, we're offering assessment, we're offering treatment, we're offering different modalities of treatments as well. So we're offering one-to-one therapy. Also, we're offering group and also online therapy through an online platform. So you, as PWPs, we are having different responsibilities. So you can kind of, facilitate a group, or we also some PWPs holding responsibilities, for example, like screening referrals. When the referrals are coming into our service, we kind of like go through the referrals and decide what appropriate how we can assess these clients and what is the appropriate treatment we can offer. Also, other responsibilities can be being like a supervisor for other PWPs or for other therapists. So you never are alone in this kind of job. You always have someone that you can discuss cases, you can go through your assessments and treatment cases and discuss with someone. So if I have to speak about like what I'm holding as responsibilities, for example, my day would look like doing 7 assessments, doing around 20 treatments per week, and also I'm holding responsibilities like supervising other PWPs, and also I'm screening referrals throughout the week. So there are a lot of pros and cons in all of this. Thank you, Maria. So I guess like here we have to share kind of like our experience and how we get in that role. I personally, coming from a different country, I'm coming from Greece. So I studied psychology in Greece, and I worked as assistant psychologist in Greece as well. So I came here in UK to do my master. So I did my master degree in developmental psychopathology. And after that, I work here as support worker in a social service home. And after that, I applied for the psychological well-being practitioner role. So kind of like I had different experience from different maybe countries. So it's not that, some of you come as well from different countries as well. Some of you have like, you already like having a background in psychology. So I think like what I want to say is that you can kind of have different experiences and different routes in order to join this role.
And just talking about my experiences a little bit, so quite similar to Magdalene, but I did a bachelor's in criminology and psychology, so a bit of a mixed one. And then after that, I went on to do a master's in forensic psychology, although I then kind of pursued the more clinical side of things instead of forensics. But I guess that shows you that you can really do a range of courses really and go into this field as well. And of course, to become a PWP, we do have a kind of a year training course at UCL, and this is where you also work in a service at the same time as studying. So it's kind of a paid master's by the NHS, which I found particularly great, considering how expensive courses can be. So that's kind of the educational route. But I guess on top of that, I think what was really important was also the kind of experience, like the volunteering that I did alongside that. So at university, I think I volunteered at Bishop Crichton House, which is a befriending service with older people. That was kind of the first time I did sort of one-to-one, like emotional support. I think those kind of roles are really helpful, but also some volunteering abroad when visiting family. Again, so many opportunities that you can really take advantage of and can just help you become a bit more confident, I guess, about speaking to people, being exposed a bit to kind of emotional conversations sometimes, and just hearing people's difficulties. And I'm sure you all have kind of an interest in that already. And I guess just briefly on kind of the paid roles that I had. So after finishing my master's, what I went into was clinical support work. So this is on a psychiatric ward. I think a lot of people go into this or assistant psychologist roles. And that can be a really good experience, although it's quite different presentations. Obviously, it's secondary care and we work in primary care. So perhaps a bit more severe kind of depression or psychosis or things like that. But still really good experience to just kind of see how you can work with mental health, how medication contributes towards that. There's so many different roles really, but I'd really encourage you to kind of get experience in any way you can really, and I think through university it can be a really good time to get that as well.
Great. Thank you, Melissa. So moving on to talking, I guess, about mine and Pay's role, which is being a CBT therapist. So CBT stands for Cognitive Behavioral Therapist, and this is the higher intensity type of therapy in comparison to psychological wellbeing practitioners who do low intensity CBT work. So most of the time when we're looking at primary care and CBT within that setting, it's kind of hybrid working. I, for example, work 3 days in the office and 2 days at home. Both the times I'm at work or at home, I do see patients either remotely or in person. So we similarly also do assessments, but also individual treatments and groups. But we might see clients who present with more complexity. So by more complexity, we might mean clients presenting with presentations such as OCD, social anxiety, PTSD, kind of other specific health anxiety disorders like health anxiety as well. So we also, of course, treat clients presenting with depression, but again, the clients that we work with might be people that have had depression for a longer period of time, several episodes, and again, more complexity. As a CBT therapist, you do also have the opportunity to, of course, be a supervisor and take on some lead areas. So, for example, for myself, I do things like I'm the drug and alcohol lead. Other people can work within the perinatal area of the team, young people's. We've got lots of kind of different lead areas that our therapists can work in. So it's really great being a therapist in terms of being a PWP and CBT therapist, because you don't just do therapy, you do get involved in doing lots of different things, which gives you a lot of role variety. Paige, do you want to add anything onto this around kind of any other things that you do differently to my role?
Yeah, okay. And I think my role is and the clinical role is kind of similar. As a CBT therapist. I think this is a very interesting area you work with. There's a lots of mental health issue. You can, have developed the interesting and to develop maybe someone in the future if you want to join the kind of working with the mental health as a therapist, you can develop your skill and knowledge in treating trauma or in particular area like a long-term health condition associated with depression, anxiety, or something to do specific disorders body dysmorphia. There's lots of different treatment, and I think skills you can develop through the training. For example, for trauma, they have a EMDR, and you know, we all train as a CBT therapy, but the case we treat is sometimes very complex. We need other modality skills to be able to combine the things together and help people in tailoring your treatment for the individual clients with the complex need. So sometimes it's really interesting to kind of identify what is the area you're passionate about, and you more like to spend the time to develop in that area. I think the work we're doing is really rewarding sometimes. Through your hard work, you can see the people after they improved and whatever reduce the depression, anxiety, and they gain themselves again to be able to continue with whatever and they want to achieve in their life, other than, you know, either professional life or personal life, or that kind of the moment give you a sense about what you have been trying to do to help people, that I feel very proud of yourself through the hard working. Yeah, the work sometimes is very challenge, but we do have a lots of support within the team. Supervision is the one of regulate and meeting, and you know, you can learn from more experienced therapists, but also and the peer supervision, you can talk about and then things and learn how to manage the risk. Lots of things are quite you know, helpful, supportive for you to kind of develop your interest in your skill in this area. I think that's quite helpful to know as a, you know, someone you haven't really decided what you're going to develop in your career, but this is something we can offer for you to know at this stage. I think in my personal experience, if I had the opportunity, someone already offered the opportunity kind of to learn what is maybe in that area I want to develop, that would be very helpful for me to you know, to know. I think this is it's a very valuable project for offer this kind of opportunity for you guys to have any questions. If you really want to know, want to join the NHS, you know, therapy teams as a psychologist or as a therapist in the future, I think you're more than welcome to kind of asking lots of questions. Yeah.
Thank you, Pei.
Mhm.
Yeah, and then and we just have a quick discussion around how maybe I got into the role, and Pei will also explain. So I did not do a degree in psychology. I actually did my undergraduate in mental health nursing, and I was practicing as a mental health nurse in the community for around a couple of years before I got into what we call the high intensity CBT training. So this is a 1 year training course similar to the PWP training course. So often when PWPs have had quite a lot of experience, they tend to want to go for the CBT or high intensity role. So that's what I'm doing at the moment. The course, as I mentioned, lasts a year, and it's similar to the PWP role in that you go to university for half the week and then half the week you are in service. So again, it's a paid course, basically. You're paid to do it, which is really helpful. And again, you're taught around about all the different types of presentations that we might treat. So as I briefly mentioned, more complex cases of depression, anxiety, trauma, and specific interventions that we would use to treat them. In terms of, I guess something that I find quite challenging about the role is that it's, I guess, because it is in the NHS, it's quite fast paced. It does keep you on your toes, but it's again very rewarding because you do get to see change with the patients that you work with quite quickly. In the NHS, we're not able to obviously provide an unlimited amount of sessions, so our sessions are very much focused. They're limited. So for CBT, we would offer up to 12 sessions, but in those 12 sessions, they're very structured in a way to really help clients work towards their goals. I remember that when I first got into kind of working in a psychology route, I was maybe one of the only people from a Southeast Asian background. And it was quite strange for me to see that, because as a nurse working in a hospital or in the community, you get lots of different backgrounds. So it was quite, I guess there was some insecurities for me back then. But actually, when you do get into the role, even though you might look different to your colleagues, different to the patients, actually it's a very supportive environment. And I think, having now worked in a psychology field for quite a long time, I do still see a discrepancy in terms of what therapists look like in the NHS. So we're hoping that this type of project will really encourage people from all different backgrounds to be interested in the role, and yeah, and look like the patients that you're treating. We always feel that when we kind of, if I was a patient and I saw somebody that looked similar to me, I think I would find some comfort in that. So we always want to kind of encourage that as well, that diversity. So my yeah, like I mentioned, my past experience was quite linear. It was university, I had a job as a nurse, and then I moved into the CBT role. With accessing the CBT role, there is an expectation that you do have some experience working in a psychology field for some time. That can be doing things like an assistant psychologist. It could be things like being a mental health nurse or a social worker within a mental health setting. So it is a little bit more difficult to get into, but often if you don't have that background, getting into the PWP training role is a lot easier, because again, you are accepted into that training course without so much experience. But again, that's something we can talk about if you have any questions. And I guess my advice would be, for anybody wanting to go into a psychology field, is do try and volunteer. It is hard to, I guess, volunteer sometimes in London, but there are opportunities. So there are a number of charities like Mind, even kind of dementia charities like Alzheimer's Society, really helpful. Might not be exactly what you want to go into, but having that kind of patient face-to-face contact will put you at a really good advantage point versus somebody that hasn't had any kind of patient-facing role. So do try and find those opportunities, whether it's kind of during your summer breaks or any other holiday time. It's really good to just have that experience under your belt. Paige, did you have any other additional things to add?
Yeah, okay. Briefly, my background, I have some degree in China, a medical degree and psychology degree. I was a psychiatrist in China for 5 years. And after moved this country, and then I started a master degree in psychology after the graduate. And then I volunteered for Chinese Mental Health Association for 3 years. And then I got this opportunity to train as a high intensive therapist. I guess very difficult to get in if I didn't have those years of working in a psychiatry hospital or community mental health team here. I think I really do appreciate that experience. That's why I found helpful when I'm doing training. So high intensity training is quite intense. Although you have kind of experience, you still need to have a full-time work, a full-time study. So I remember when I was in the training course, that was probably about 10 years ago. More than 10 years ago, and then on our course there were a lot of clinic, there are lots of training. They are already PhD, or some graduated, and they also find it quite challenging. So it's really good to kind of knowing that if you want to kind of pursue as a this field, you need to have some working experience in the mental health background. I think that will help tremendously. I think otherwise it's again similar with we all talk about every here charity work. Even I don't know where your background is. You just probably, if you want to working in the UK in the future, probably you need to find a way to get some experience in this country, and then probably that will give you more chance to get into the either the clinical psychologist or as assistant, or probably PWP training first, and then you can go into high intensity training. So good luck for that.
Thank you. Okay. And then just, I guess, finishing off with discussing the program which we are offering. So we've given you a little bit of introduction into our backgrounds and what we do in our jobs. And now, like we mentioned, we do want to encourage diversity in the field of psychology. So what we want to offer is a mentorship program, essentially, within Westminster Talking Therapies. So this is a 6-month program starting in January 2025. So the program itself will allow you around opportunities to come into the service and have contact with our team. So this can be, sorry if my mic's keeps dropping every now and again. So this will be having opportunities to talk to kind of our team members, so CBT therapists, PWPs, and shadowing kind of the work they're doing, so that being assessments and interventions as well. So this, for the first 3 months, you'll be invited to come in 1 or 2 times a month and again, get that exposure, which we think is a really great opportunity because we've, as training therapists, I don't think we ever got that opportunity when we were doing our undergraduate degrees. So it will hopefully give you some first-hand experience as to what the role is really like. The other half of the program, which is the last 3 months, will be offering just some mentoring. So this is one-to-one with one of your allocated mentors. So all 4 of us will be mentoring. So you might get one of us to be kind of allocated to you. So we will be in contact with you each month just to support you with anything that you need in relation to the program. So that could be thinking about the job role, ideas as to how you could get into a PWP training position or other psychological fields, but also a place to give you some advice and general support around your development as a person going into psychology. We've also got the opportunity for you to be involved in additional projects like outreach. So we've got a very good outreach program in our service, and this typically involves going to different places in Westminster. So this could be religious places, it can be local libraries, local GP surgeries to I guess increase access into the service. So you might have the opportunity to do that with our outreach worker. And if you are interested, the applications will be open after the presentation. I will be sending out the application form. It's just got a couple of questions just for us to get an idea of why you want to do the program and what your understanding is around certain backgrounds having difficulty entering any psychological work. So so if you've got any questions, please let us know.
Okay, fantastic. Thank you so much. I think traditionally in career events, we often encourage students either to directly ask or to put their questions in the chat. Sometimes our students are a little bit shy and don't want to kind of step up to the mic and talk about this. I think one thing that might be really important is to stress that this is for year 2 students. So this is the program is, if you want to be a part of this fantastic program, then it is for year 2 students. Could I just, the 4 of you, whoever, could I ask one question that I know I get a lot from conversations with students? And this is kind of the relationship. A lot of, I think, our students, when they start, they hear kind of like, oh, I want to become a clinical psychologist. And so I know that at least some of my students that I mentor or my personal tutees, they became psychological wellbeing practitioner with the goal of eventually becoming clinical psychologists. But it seems like there's also the second route when you go into like high intensity / CBT. Could you just kind of maybe talk a little bit about where, if I am a student, I'm listening and thinking I want to become a clinical psychologist, is, for instance, something like a psychological wellbeing practitioner something for me? Should I consider that? And maybe just kind of put it a little bit into context for students. I think that would be really helpful.
Yeah, I don't know if I should maybe pass this on to Melissa and Magdalena, as you're both PWPs, and what you think of that.
Yeah, so like you said, it is really popular to actually do as a kind of stepping stone for either high intensity, which is kind of what Maria and Pei are doing, or clinical kind of doctorate. I do think it's a great experience because you you do a lot of patient-facing work and a lot of independent work, and you can really develop a lot of skills. I know I'm completely different to how I was kind of coming into the course, and that's something I did want to mention earlier. Like you learn a lot like whilst you're doing the job itself. Like don't, not apply for it just because you feel like you can't do what the role kind of entails. But sorry, I've kind of got lost with my answer there. But in terms of the question, sorry, was that the distinction between clinical doctorate?
I mean, could I just if I may, could I just directly ask you, do you do this then to eventually become either a clinical psychologist, or maybe this is like putting you on the spot, or like a CBT, or is this something like that's just often I think how people kind of view this in that context, but maybe that's wrong.
So personally, I mean, I didn't go into the role with the intention of kind of doing a doctorate or doing high intensity work. It was just a good opportunity to really have that one-to-one work and kind of develop my skills. I haven't I mean, when I first applied, I wasn't thinking kind of forward, like this is something that I want to do as a result of getting another role. I do think there's a lot to be learnt from this role itself, but having been qualified for almost a year now, I do personally think I will be going on to the high intensity role personally. I'm not too keen on academic like writing and research personally. I think that's a big distinction. I do prefer that more clinical side of things, and I think there's still a lot more to learn in terms of cognitive behavioral therapy. So that's sort of the route that I'm thinking of taking.
So I just want to add here that, yeah, I think the majority of the people, they see PWP role as a start of the route, of the clinical route they're going to have. But I just want to mention as well that there are a lot of other roles in the PWP kind of role. You can go higher in terms of the payment, in terms of responsibilities. You can get like senior roles. So there is progression as well in the PWP role, and PWP role can offer you a lot of things. I think like I personally as well, I'm seeing myself of kind of progressing in terms of my clinical work, and I want to apply for the high intensity. But as well, I'm thinking other routes inside the role, and I think like it gives you the majority if you want to go in a more managerial role as well. After a while, after you become qualified for a while, you have that opportunity as well. So it's not only only a route to go for the clean psych or to go for high intensity. There are other routes as well inside the PWP role. Yeah.
Okay, fantastic. Yes, I think, I don't know if anyone wants to add something. This is often, I mean, it seems also to be in a great place where you get paid to do something that you're passionate about. And then maybe from that foundation on, kind of like build your career, whether you progress in one of these different ways. Okay, fantastic. I think another question that I get basically asked on an almost daily basis is, do I have to do a master's? I think the answer is no, but I think a lot of students don't trust me when I say you don't have to do it. If I show them the requirements, no. But maybe you want to talk about this as well. I don't know, Magdalena or Melissa or like Maria. Yes, yeah. Sorry.
I think the answer is no. No, you don't have to do a master. What they look, at least for PWP training, is to have a background, maybe have volunteering, as the girl said, like it's really important, have work in mental health sector or other sectors that they're around psychology. Even with a bachelor in psychology, you can get in. I had many people and many friends from my training that they did for 10 years a totally different job, and then they just did like a bachelor in psychology and they got into that role as well. So it's not necessary that you need to have a master degree or something higher than that in order to get the training. You just need to show your interest in psychology with maybe volunteering or other roles you might hold.
Fantastic. There's I think great question. Where do we find psychological wellbeing practitioner training? If I want to apply, I think UCL. I don't know where you did yours. Yes, is you both of you and everyone is nodding. Is it UCL, the one you did, or?
I personally did UCL. So if you Google low intensity cognitive behavioral therapies training in UCL, you will find their website where you can see and apply. It's a postgraduate certificate.
I know that there's a follow-up question on it. I know there's some where you apply directly to UCL, but there are also some trusts who offer that, right? I think we had somebody who basically applied to an NHS trust, and then she did it, I think, at East Anglia or something like that. So yeah, so there are different ways. Okay, I think Melissa put something. Oh, she put the slides in there. That's fantastic. If somebody wants to have the slides.
It's actually, sorry, the link
Oh.
to where UCL talks about the training, because it's sometimes a bit confusing. I also looked up PWP and then it's completely different name. So it's low intensity cognitive behavioral interventions.
Yeah.
Yes.
I think some NHS trusts do it directly through their kind of careers, but if certain universities like UCL, because they cover most of London, they will kind of advertise it through their website, I believe.
Yes. Yeah. You apply directly there. So my students did that. Yes. Okay. Fantastic. Okay. Could I just to apply? So it's UCL. It seems like a little bit more confusing, but in London, if you want to do it in London, UCL seems to be the primary. I think East Anglia has one, and a lot of this information is also on our careers Moodle page if you're interested in that. Magdalena, could I ask you a very specific question? But we have a very like in our the psychology undergrad with a lot of international students. And so one of the questions I know for if you do the doctorate in clinical psychology, then if you're an international student, I think you have to pay, at least you don't get paid. Was that the case for you too? Or did you, because that's often a little bit more complicated once you're like, yes.
Oh, you're on mute.
Sorry, I can't hear you.
Sorry. Yes, I guess I cannot give the answer is because when I came to do my master, I came before Greece, before United Kingdom go out of Europe. So kind of came with some specific laws which I had the right to apply for a settlement status. So I'm holding that settlement status. So I didn't have to kind of pay for international yeah.
Okay.
Sorry, I don't answer it, but yeah,
Okay,
I'm holding a settle from before Brexit.
Okay, fantastic. I think another one, which is like a topic, if I could just pick that up, I think a lot of what we recommend our students to do when they're bachelors, which you also mentioned, is either to start volunteering, and there's a question about this. I think I often perceive it as relatively easy to get volunteering experience if you're like there are now like I don't know, there's so many charities that need people to help them support people with mental health issues. I think there's one question where ask if there's like for the training without prior experience. I don't know if you have any like comments on that. I can also answer this question if you want to. But just like volunteering experience. The other thing, which some of my students also do, or our students, sorry, is you mentioned support roles, right? I think one of you was clinical support worker, and another one was also, yes, okay. And I think one in the psychiatry and one in, I think, Melissa, you were somewhere else, right? Like
psychiatric ward, yes.
Oh, so okay. So I think this is like two avenues we often kind of highlight. Yes, so like volunteering. Do you want to say something about the difficulty or finding a volunteering experience or not, or from your point of view?
Yeah, I guess with volunteering, sometimes it can be a little bit hard to know where to start. I think when I was at university, they sort of sent around emails with opportunities, and that's how I got into Bishop Crichton. Otherwise, it was sort of finding things on my own that were kind of local to me. But I get what you mean about things making you eligible for kind of the course. I do think often before going onto the course, people have been in some sort of paid role. I think for Magdalena, you mentioned it was assistant psychology. Mine was the clinical support worker role. And I think a lot of people do get into that, first of all, to then have sort of some experience in the mental health field. And then that really helps with the application process, having things to speak about, having, skills to kind of sell yourself on. So that can be a good avenue to just get into the field. I would say, with psychiatric wards, it can be pretty tough. The role itself, it really depends on how you find it, but it's really great learning experience, but it can take a bit of applying and kind of seeing what they want and how to best sell yourself in the interview. I know I spent a while trying to get one of those roles, but after that really helped me get onto the PWP course, and I got it after kind of 10 months on the ward and applying for the PWP course. That's how I kind of got on it. I hope that answers your question, but let me know if it didn't.
Do you want to add
Can
something? Yeah. Yes,
can I
please.
add something? I just want to say that I personally think that the support worker role that I was holding was the reason that I got the training. I think like support worker role is it's really challenging role, but I think it's an amazing start. It doesn't require like to have work experience in something similar. So it's your first kind of work experience that you can have in order to get into the field. And the reason I'm saying is support worker role is why I'm in PWP is because when I did the interview for PWP, all I have to say was about my support worker role here in the UK. I had to say all of my qualities or my experience or like all of my skills. I had something actually to support that I have done it. And in a support worker role, you get skills and you have like all these examples to offer in your training and support yourself in the interview as well to get into the training. So I think it was the most important thing that I had here.
Fantastic. I mean, I think from my experience with like working with students who got into the role, I think some of them did placements during their year-long placements, and then I actually got on, basically graduated in June and got on, I think in September or October, whatever into the program without having a paid role. Most of them that got on have some kind of mental health support work for at least half a year. I think there's a January intake as well. And then, so I think that really, I think my experience very much mirror what you're talking about. Okay, fantastic. I don't have any more questions, not that it's about me. So I think we answered all the questions.
I think
there
asked
was
about child practitioner role.
Yeah, relatively new role. I put the link in there as well for UCL. I don't know, Melissa or anyone. Does anyone know anything more about this? I know one person who's on it, but yeah, I don't.
I don't know if anyone else can add, but the PWP role is specifically for adults, working with adults, or we do work with 16 to 18-year-olds as well now. But the child wellbeing practitioner is a different course, so specific to younger demographic. But I think you should be able to find it similarly. I'm not sure if UCL does it, but it might be
There's
applying
the
for university.
UCL link is in the chat.
Is there? Yeah. Okay.
Yeah.
So UCL would do it as well, but it's just a distinct course, but very similar as well, overlap.
Yeah, maybe if you like children, then that might be yours. Program. I think there's an educational psychological well-being practitioner now as well, if somebody's a little bit more interested in educational settings. So it seems to be proliferating. All right. I think we covered everything. Thank you so much. Maria, could you just, the formal points of the application for the program, you sent me the application form and I'll share it with the students.
And you can distribute it, absolutely.
And I think I remember from last year in the form is kind of like the explanations of how to submit it. Is there a deadline, which is like one of the most?
So I will send it today, and then we've put a deadline for a week. So again, it's a very short application. There's just 2 questions to answer. Once you've completed it, my email is on the bottom. So if you can send it back to me by the 4th of December, and then we will let you know the applicants that were successful the following week. So we basically want to do this all before Christmas because we know how busy it gets. So then you're all kind of set and ready come January, and we can send you all the information you need.
Okay, fantastic. Lovely. Thank you so much. I don't think I see any questions anymore. So yeah, thanks for doing that. Really appreciate it. And good luck with the mentor program, and hope to see you next year.
Yes, absolutely. Thank you, everybody. Thank you all for your time.
Thank you.
Bye.
Cheers.
Thank you,
Bye.
everyone. Bye.